Golden Blunt is no stranger to vascular problems.
How have things been since we saw you last?
That's why vascular surgeon Dr. Dennis Gable is making sure his carotid arteries are in good shape.
Carotid arteries are the two main arteries in the neck that supply blood flow to the brain.
Patients with carotid artery disease have plaque buildup that results in narrowed or blocked arteries.
Carotid artery disease, I always tell patients, is a marker for atherosclerosis. It's hardening of the arteries. Let's take a look here, take a listen to you.
Although there are few visible symptoms, some patients will experience a transient ischemic attack, also referred to as a mini stroke.
Can be loss of function of an arm, loss of function of a leg, or can be even up to loss of inability to speak. But then they fortunately recover that after just several minutes. Deep breath for me.
Others have no warning.
They come to the hospital with those symptoms, diagnosed with a stroke, and on further evaluation are found to have a bad blockage in the carotid arteries.
Most of the time, doctors use ultrasound to diagnose carotid artery disease. Arteries with less than 70% blockage are usually monitored. Oftentimes, more than that requires surgery.
I was not in trouble, but he said you're going to have trouble if you don't get it done now.
The treatment for carotid artery disease varies. Most commonly is done with the carotid endarterectomy, which is a surgical procedure. However, in some instances and for some patients, we can also perform carotid artery angioplasty and stent placement.
Patients with high cholesterol, high blood pressure, or diabetes are more likely to develop carotid artery disease. Because these conditions are often associated with increased risk for high cholesterol and plaque accumulation, doctors recommend a strategy for maintaining vascular health.
Prevention of stroke is not a pill that you take. It's not a single procedure that is done. Prevention of stroke is a lifestyle change. If you're smoking, you got to quit smoking. If you're not exercising, you got to get out and exercise. You got to watch what you eat, what you're consuming, the portion size of the food, the amount of calories you're taking in, the types of foods that you're eating. That all sounds real good. I don't hear any bruise in there in your neck.
Once a patient is diagnosed with carotid artery disease, regular checkups with a vascular surgeon are essential.
But it was not a big deal to me at all. And I don't think it's a big deal for anyone that has a good position.
Ask your doctor about your risks for vascular disease. Visit vascularweb.org to find a vascular specialist and learn more about vascular wellness.